to India now, where confirmed infections and deaths in a devastating second wave have dipped below record levels. But there's concern that many cases are not being reported, particularly from a surge in vast rural areas. These regions lack adequate testing and healthcare infrastructure. DW's Nimisha Jaiswal visited a village near the city of Meerut in Uttar Pradesh, where there has been a spike in deaths caused by fever.
It has been an exhausting month for Syed Chauhan. For weeks, his son Haseen was racked by fever and troubled breathing. Chauhan, who raises cattle for a living, finally arranged a car to take his son to the hospital in the city. Haseen tested positive for the coronavirus. 4 days later, he was discharged. Not because he was feeling better, but because they had already racked up a bill of about 1,500 euros. Haseen, a daily wager, earns 5 euros a day when he can find work.
It didn't improve at all at the hospital. We somehow arranged an oxygen cylinder at home with great difficulty. I had to borrow money from several people. We didn't have a rupee, but for your child, you'll do anything.
The family of 30 lives cramped together in close quarters. They have been lucky that no one else was taken seriously ill, and even luckier to get a diagnosis. Many are falling sick in this village, which lies 100 kilometers east of the national capital. But there is no testing here.
There are no government health facilities in this village. Small private clinics like this one are the only stopgap and have fielded hundreds of complaints of fever in the last month alone. They do not have the provisions to treat the coronavirus and refer patients to the city. But treatment there is expensive, and given the curfew, it is very difficult to even travel there.
Sunil Kumar has a car and could afford treatment for his father and siblings. He even arranged beds through a contact. He lost all 3 of them last week. The doctors asked the family to arrange medicines, but they were sold counterfeit bottles. The overwhelmed hospital charged thrice as much for services. Recounting the horrors of what he saw, Kumar is skeptical about the number of deaths being reported in the state.
I kept getting calls from the authorities for 3 days after my father's death, asking after his health. I told them he'd passed away. I don't even know if his death was counted in the statistics. I saw 8 bodies carried out of the hospital the day my father died. 2 were from my family.
Without diagnosis, fever deaths are on the rise. Jameel Chauhan, a social worker, describes what has been happening. First, they have a fever. Then they feel breathless. Many eventually die at home.
In this house, someone died. In that house too.
Chauhan says there are 50 fresh graves in this cemetery alone. Residents say cases of fever started spiking after rallies were held here for local elections last month. Chauhan started making a list of deaths in the village. The cause of death for most is fever and breathlessness. Almost none of these have been recorded as coronavirus deaths.
Every day people are dying. Nobody has been tested. We haven't been told anything about the vaccine. No one here has gotten it. No doctors have visited us.
For the last year, this village has been relatively untouched by the pandemic. Now, residents are terrified. They fear that as recorded cases flag in urban India, the coronavirus will continue to wreak unseen havoc here.
Well, for more, I'm now joined by our correspondent, Nimisha Jaiswal, who filed that report. Nimisha, we're seeing official numbers, at least, heading in the right direction, which is a good sign, but it seems that India's COVID-19 crisis has shifted from urban centres to the countryside. What does that mean for the country's fight against COVID?
Well, Rebecca, it mainly means that the optimism we can feel about numbers dipping may be too early, especially as we're hearing more and more reports, much like in the village that we visited, that there have been many fevers and many deaths which have been completely missed by the coronavirus statistics that we are feeling good about right now. Of course, India's numbers continue to be above 200,000, above 200,000 a day, which is also a significant number, of course, and is the highest globally. Many of the infections have now shifted from major centers like Delhi and Mumbai to other smaller cities. But even then, these are the numbers that do still get recorded. Even in the cities, many struggle to get tested at the peak of the surge. And now there are large swaths of the country that are being completely missed when it comes to testing. And this definitely impacts India's ability to respond to the virus if it's completely being missed in so many places.
What is the government doing to respond to this crisis?
Well, the good news is that the crisis in rural India has been acknowledged. Prime Minister Modi said that local leaders as well as local healthcare workers will play a large role in fighting the crisis in rural India. So this has been taken note of by the national government. However, there are large holes in healthcare infrastructure as well as logistics, which is not something that you should be reacting to as the crisis is developing, much as what we saw in the oxygen crisis in the cities. It was a bit too late to be responding at this point of time. So right now, again, there are these holes within the rural healthcare infrastructure that need to be urgently addressed. An additional concern is that governments like the Uttar Pradesh government in the state that we visited have actually cracked down on villagers for seemingly telling lies to the media instead of rushing to their aid, which also raises further concern that these problems are not being acknowledged the way they should be.
What more then could be or should be done?
The focus, Rebecca, seems to be on ramping up India's vaccination drive. Just today, Prime Minister Modi said that we must take collective responsibility to expand the vaccination drive. However, there are significant challenges. The government says that there will be a much larger amount of doses available by July. But right now, anecdotally, when we look at available doses, it is still a fight to book a slot to get an appointment, especially between the 18 and 44 age limit right now. In addition, even when these doses eventually become available, there is a high amount of hesitancy. There are many rumors and disinformation going around that the vaccine may actually harm you rather than help you. All of this will need to be urgently addressed if that third wave has to be fought off.
DW correspondent Nimisha Jaiswal in Delhi, thanks very much.